it's your buddy Peace and Harmony with you here today. Before we get started and zoom in and focus in, I want to give a quick shout out to my viewers who have recently made a donation to the channel. I can't tell you how much it means to me that you find value and resource of knowledge, inspiration, light, and guidance here to help diffuse the pain of sometimes very difficult, confusing, and complex relationship issues. When you find yourself in over your head, I'm so glad that you have found a resource and a home here on the channel, and it really keeps me inspired, it keeps me motivated, and it lets me know that I am hitting home with you, and that is my goal, objective, and outcome is that you can better learn to understand and navigate the relationship and come out feeling healed, whole, healthy, and inspired for your own life and the direction, and really something for you to get excited about and heal through. So thank you so much again for your recent donations. I really, truly appreciate it. And really, I want to zoom in and focus in on a viewer question that we got in here. And that is the covert narcissist and therapy. What do you do if you've gotten to the point where enough is enough, you've hit rock bottom, and now you are in therapy? You could be in couples therapy, marriage therapy, you know, some sort of support group at your local healthcare facility, and you just kind of feel like they're walking the walk, but they're not talking the talk. They are putting on a mask, a facade of wanting to improve and change their ways because of some truth and validity to what is being presented in the sessions, but yet, you know, they just kind of nod their head, yes, 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 and then they really just kind of bust apart at the seams, and they go back to their old ways. In other words, they're not really making progress. They're just kind of on a pretend cycle, a facade cycle, where they're putting forth the mask. They're, you know, it's the kind of a shell of, okay, I'll do this, you know, to improve, but they're not really making the adjustment. They're not really making the change. And if you do not see progress from therapy, from networks, things of that nature, generally it is because that person does not want to, is not willing, or capable to apply the lessons to change. And so one of the issues with that presents with the covert narcissist is because of their pathological sense of self-importance, and really the fact that they kind of always feel justified and correct and right for being the way that they are. You know, I am this way. I'm just always this way. So they don't have an ability to use metacognition or empathy because of their deficit of empathy. They don't really get what your needs are. They just don't see it. It's as if they don't have empathy glasses on. They can't see to the other side of the river. They can't see to the other side, to the other shore. All they see is their perspective, you know, where their goal, objective is, and their needs on the horizon. They don't see that there's someone else on the other side who is hurting, who has been victimized, who has received cruel treatment or ignoring. They don't see the withdrawal of communication as an issue. They don't see their self-absorption as an issue. They don't see their grandiose self-importance as an issue. They don't see that they have really caused any scuffle. They don't see it. So oftentimes, because of these two components, the pathological self-importance, meaning this is just how I am and I'm going to do whatever I need to do, and then coupled with a lack of empathy, it's not just a healthy narcissism, but when you start getting into unhealthy narcissism, where you're being cruel to others, you're withdrawing communication, you're treating people very aloof with disdain, and it becomes very a cruelty or a deficit or a gap, a rift, you know, a divide in the relationship, you know, then, you know, you're talking about relationship issues, and that's really one of the first things to present. So for anyone to improve, you have to be willing to see, and you have to be the one to want to change. So oftentimes the narcissist, and definitely not someone who is psychopathic, you know, they have to see that that they want to change. So for example, let's just equate it to someone who is overweight. You know, if they're happy at their present, you know, morbid obesity, you know, and they don't feel the need to change, they can go to weight loss sessions all that they want, but you know, they're just going to take in the material and then they're just going to go back on their emotional eating. They're going to go back to the pizza buffet, you know, cheeseburger haven, whatever it is. They're not going to change their ways. They're not going to see the root of the, you know, the cause, their emotional eating, what have you. Likewise, you know, the alcoholic, someone who is powerless over their addiction and doesn't want to change. They haven't hit rock bottom. It hasn't been severe enough to see where it's an issue. They're comfortable in the hiding of the alcohol. They're comfortable in the drinking, you know, vast amounts and sneaking away and sneaking the alcohol, you know, as long as nobody finds out, as long as nobody brings it to their attention, they don't care. So it is, you know, it's almost an exercise in futility. And, you know, you can go to your healthcare provider, you can go to a therapy for 55 minutes, you know, you can bring them into these sessions, but until they really see what they need to change and the adjustment and it hurts enough for them, then they're not really going to be making any progress. And the, you know, it's almost kind of like a badge that they're going to wear. Oh, well, I tried, you know, I'm doing this for you. You know, I went and did this for you, but they don't really, you know, it's kind of like, just kind of like a badge of honor that they can kind of rub in your face and just basically be like, well, we tried this and see, it didn't work. See, I told you so. And it's just something that they can just basically dish back up to you. And so, they don't see the facade of their ways. They don't see the public and the private self, the, you know, the true, you know, difference. They don't see that as an issue. They think that, you know, putting, you know, having a put on is what it's all about for them. And in the recesses of their mind, you know, they might know, you know, I'm this son of a gun or whatever. You know, they might understand this, but they're not really willing to change. So, you know, when you're talking about therapy, any sort of therapy, the person has to want it and see what they need. And so, you know, they might say, okay, I'll go along with this, but until, you know, you really understand, and perhaps this other party then presents to them and says, well, you know, look at your, the lack of empathy, you know, this is what is hurtful, and able to really show it to them. And they say, they can look at you and genuinely say, I'm sorry, you know, I didn't mean to hurt you in this way. And they actually see it and they get it. And then they change, they apply their lessons. Well, that's a different story. But oftentimes a narcissist, they'll just kind of be like, you know, just kind of giving up and just saying, well, this is just how I am, you know, love it or leave it. They're not really willing to make adjustments. And, you know, that's just how they are. It's a little bit kind of ingrained in them. It's part of their blueprint, their chemistry, their, you know, their neurology. The brain regions of their mind are based on that reward system. But usually it's the other person who is the suffering that comes into therapy. The person who has, you know, gone to all ends of the earth to try to obtain their love. It's the other person in the relationship who has, you know, basically depleted their adrenals to the point and, you know, basically worked and tried to salvage the relationship and make them happy versus making themselves happy. So it becomes this very other-focused sort of relationship where a true balanced relationship, someone who doesn't have a lot of these personality issues, will be able to validate you and love you for who you are. So they'll be able to see you for you and not a projection of what they need onto you. It's a very, very big difference. And if you've been really around a lot of narcissistic people who have projected their needs on how they need you to be versus who you are, you're kind of developing this, it's kind of like I just think of it kind of like a pearl. Like there's a inner fine grain of sand, and then basically, you know, it's in the shell, and then the, you know, the all the to detract from the irritants, the inside of the clam releases this mucus and keeps coating it until you get this pearl, you know, inside. So it's kind of like, that's kind of like you know, how a narcissist is. Basically, if you're not serving them, you're like an irritant. So they're just going to keep projecting their needs onto you versus trying to get to know you, who you are, and, you know, helping you flower and become the best that you are. I mean, it's not that, they're focused on their needs and how you can be an extension of them and make them look good. So there's not this empathy, there's not this compassion, there's more of a self-centeredness, and, you know, how can you satisfy my needs versus, you know, who are you? You know, I think there's a prolific saying, you know, seek to understand, then to be understood. So it's really, you know, backwards, upside down in a relationship with a narcissist. They want you to get them and basically be there to laugh at them, applaud them, you know, give them what they need, treat them, you know, and just basically be, you know, an outlet for them. So it's a little bit different dynamic. So I hope this helps you understand how the narcissist, you know, and of course there's always interdependency of needs. You know, we want to laugh together, we want to walk together, we want to travel together. I mean, there's togetherness when you talk about relationships, so it's interdependence of needs. But when someone is constantly projecting their needs onto you, or their hostility, and they're not there for you to be supportive of you, and kind of revert to these aloof ways and aren't meeting you in the middle, it's because they don't have that motivation, that direction, that drive. It's not rewarding for them for some reason. It's a low incentive activity, and so they will not engage in that sort of relationship dynamic pattern. You know, until they get excited, until they get motivated, until they see that pleasing you will please them, it's going to be oftentimes an exercise in futility. Peace and harmony with you here today. I hope these videos do help. Please share, please subscribe for more great tools, videos, discussion, and support.